Good morning. Good morning. Thank you for coming on to our call, all you early birds out there. Welcome to our Friday virtual coffee. We are literally 2 days away from AEP officially starting, although, as we know, the last 2 weeks has been all about being able to talk about, obviously, the brand new products and brand new plans for 2024. And also the new rules are coming in for the CMS marketing rules for 2024. So hopefully we've been kind of a little bit aware and practicing what they are bringing to us and the changes, etc. So we've got some good information today on that. In fact, I'm going to recap some of those marketing rules. I've been asked a lot of questions this week, and that's what we're trying to do throughout AEP, is really focus on some of the things that we're getting asked during the week and bringing it to you every Friday. We are recording this call, so those folks that are either at events already or still getting up, then you're going to be able to listen to this every single week. And as you can see from our little slide, every morning at 8 a.m. during AEP, we are here with you every Friday morning, not every morning, every Friday morning. So I'm thrilled that we're able to do that for you. We've got quite a bit to get through today. We're going to try and keep it to under an hour, but hey, you know, the information is important. So we're just going to go until that information is being given to you guys, and then we'll move on with our days here. As ever, we have Judy Daniels from Berwick Insurance Group on the call today. She'll be running through some of those new CMS premiums, Part B, and all that information came out yesterday. You might have seen it. Judy's going to run through that today to keep you right up to date. Okay, let's get started without further ado. So welcome. If you're brand new to AMA or a brand new agent, thank you and welcome. It's great to have you on the call. If you've never been on here before, we're on here every week. If you have, then you know the drill. We're going to do some updates. We're going to talk about some of the final rule updates. In Judy's corner, she's going to talk about the premiums and deductibles and all the changes for 2024. Then we're going to talk through some of those updates from our carrier partners. What are they doing to help drive engagement with agents as well as carrier kit pickups? All of that stuff we'll cover towards the end, and we'll get you out of here as soon as we can. Okay, AEP starts on Sunday. Guys, I know a ton of you have already got appointments, meetings, and stuff going on. It's, you know, exciting this year. I'm expecting this to be my agency's best ever year, and I think a lot of you are thinking the same as well. Hopefully we're on the same page there. There's so much disruption throughout all the different states and all the different counties. It's pretty insane, to be honest. I was at a meeting yesterday and talking to somebody about the disruption in San Diego with Scripps, and that's kind of getting out there to not only folks that are doing Medicare, but, you know, I was talking to a couple of nonprofits and in San Diego, and they've even heard about some of the disruption. So all this information is out there, lots of things going on. I'm in Napa today to talk to a group of newer agents about some of the disruption in Alameda County and the fact on DSNP, you know, WellCare's leaving. And then we got Ventura, where Blue Shield is going away, and Sacramento, where there's all this stuff going on. This is creating opportunity. So if you are not involved with some of these things in counties that you're in, then it's a great opportunity for you to talk to Medicare eligible folk about how you can help them and keep them on track and make sure they are on the best plan. The other part this year that I think is going to be really prevalent is the fact that there's a disruption with prescription drug plans. The Inflation Reduction Act is really driving those premiums up. Apart from one outlier, we know WellCare is bringing in that 40-cent, 60-cent plan. It's an outlier. I know some of you are a little frustrated with that because obviously we feel it's going to be a short-term fix. It is commissionable this year. So if you put people on that plan this year, it is commissionable. So, you know, that's an important note. However, I do think you are going to see continued disruption with prescription drug plans. Those premiums you've seen increase this year are going to continue to do that. I really believe so, particularly next year when the maximum, when 2020, next year, I mean 2025 products, when the maximum anyone's going to pay for their prescription drugs is going to go to $2,000. You are going to see a huge increase in deductibles. I think you're going to see MAPDs have deductibles, possibly. You're going to see premiums go up. And what does that mean? That means somebody that's on original Medicare that has a PDP with a Med Sup, their costs are going to increase significantly. So that might be an opportunity for those folks to go on to some of these Medicare Advantage plans, including PPO plans. We know that this year, a lot of those carriers are really kind of hitting their own lane, their own kind of area where their expertise is. We've seen United bring out a ton of PPO plans in California. They're already out there in Nevada and other states as well. But in California, you are seeing in most counties, you know, United Healthcare bringing their PPO out, including San Diego County's brand new, Ventura, Kern, and again, all that area in the Pacific Central Coast. And this is good for two things, where your medical groups are a little limited. A PPO plan enables those folks to get more access to care by seeing other doctors. But also with United Healthcare, you do have the opportunity to see their national network. It's not a local PPO. You might have seen an LPPO. An example of that is Alignment. A lot of their PPOs are LPPOs. It means it's a local PPO, so you only have the local medical groups, and it's only a local network. United Healthcare and Humana and Aetna, they do have more of a national basis, United being the biggest. And of course, there's some great medical groups that all of these carriers cover. United in particular have Cedars, UCLA, City of Hope, all of these that are really important. And even if you're out of state and you're receiving care in a neighboring state, a lot of folks, if there's a serious illness, want to come to somewhere where they know is in the top 5 hospitals or medical groups in the US. So that's another part of this as well. So I think you're going to see that transition of folks coming from Med Sup to some of these PPO plans. Okay, so carriers have all those materials. If you missed out on your pre-ordering, you can order. You can order from now. And carriers are doing pickups and kits and coffee and kits, and they're calling it all sorts of stuff where you can grab kits. You should have kits in your car. If you don't, get some. You're not going to be able to sell. You're not going to be able to offer these products without having kits. So if you do not have 2024 kits, please order them. If you're not sure, reach out to Lisa, reach out to one of my team. We can help you. Of course, we're here for you, but order those kits. Go and get these kits from your carrier partners. This is important. Even if you're doing a, again, even if you're doing an electronic enrollment, you should be handing them a kit. One thing I want to talk about as well is part of those kits, you've got to give them a receipt. So if you're in person, you should be a receipt in every single kit. That's what you should be doing for these folks as well. Okay, we're going to talk through those CMS rates a little later on. Judy's going to run through that for me to give me a break. And then I'm going to talk through some of the new rules that have already come into play. We did a new sales reporting webinar, thanks to the 40 or 50 of you that came on. So all AMA sponsored events, this includes MRCs, sponsored or co-opt events that AMA is doing. We are looking for you to send us feedback every time you're doing that, please, through our AMA portal. If I have time, I'll quickly show you guys today how easy it is. Last night, we sent out a reset from our WordPress account. So if you haven't logged into the AMA portal, search WordPress. It should come up about 9 p.m. last night. You can then get in from that link. Everyone was sent that, so you should be able to see that today. But we are looking to get that reporting. The reason is it allows us to invest in you next year, because guess what? We can see what's working, what isn't working, and what marketing we can do and help you with. And of course, that 48-hour scope of appointment is in play as well. If you work a kiosk or an informal event, then it's a walk-in. Don't forget, try and get folks to walk in. If you book a specific time, it's an appointment. If you say to them, look, I'm going to be here between 9 and 12, come and see me. That's a walk-in. You're not expecting them at a certain time. They'll walk in and see you. Again, if a telephonic call comes in on your phone and it's a Medicare eligible looking for information, you can do a scope straight away. You don't have to wait 48 hours. That's the two scope of appointment scenarios that I wanted to bring out. So again, you can get a virtual walk-in, and that is somebody that's calling you that you are not expecting to. Okay, we're going to look quickly at some of the final rules. This is a document that we had put together for you guys on our portal. Just want to run through. Call recording, TPMOs. So we're all a TPMO. We are a third-party marketing organization. That's our title when it comes to marketing in the eyes of CMS. You only need to record marketing, sales, and enrollment-related calls. CMS received lots of feedback on this. So marketing, sales, and enrollment calls. So if you're calling somebody to market a product, talk about products, that's got to be recorded. If it's an enrollment call or a sales call, that's the two other requirements as well. What I would say is, if in doubt, record the call. It's as simple as that. If one of your clients is calling you and it's not a sales call, you don't have to record it. That's a real big improvement from last year, and it's going to really help us as well this year. Zoom and video calls, absolutely. They also require recording. You don't have to record the video, just the audio portion of the call. So again, that's an important note to have on here. If you want to take a photo of this, and these slides will be available, and they are already available on the AMA portal. Misleading marketing. So again, the Medicare name, a lot of people have said to me, Neil, you've still got Medicare by AMA in your name. Well, as it says here, CMS believes the use of government agency names or images could be misleading or confusion. So again, it does restrict the use of the Medicare name, the CMS logo, and products and information issued by federal government. So again, if you are including the word Medicare or the card, it has to be in a non-misleading way. That's very ambiguous, folks. So putting on there to the word Medicare, obviously some disclaimers about not being affiliated to the US government is going to help that. Obviously AMA, after discussing this with compliance, decided we were going to keep our name currently. Whether that will change next year, we currently don't know. But again, if you do have the word Medicare, or you've got the logo or the Medicare card, and again, I did post a few weeks ago, there is a website for you to get that authorized as well, the use of the card. Modified TPMO disclaimers. The new disclaimers, if you don't represent all the plans, is this: we do not offer every plan available in your area. Currently, we represent 16 or whatever organizations which offer, I don't know, 100 plans in your area. Please contact Medicare.gov. A lot of people have said to me, Neil, how do I find that number out? Well, the best thing to do is to go into Medicare.gov or into your Medicare center and just list them all and count them up. And again, this is not necessarily where somebody's going to count up and say, you said you represent 38 plans and actually you represent 39. Is that ever going to be counted up on? No, it's not. The fact you have the disclaimer out is the key point on here. And if you know it's over 100 plans, you could put on there, I represent over 100 plans in your area, something to that effect. In fact, that's what we have on our website. So again, that's an important note, I think, here. So that new disclaimer is on there. If you do represent all the plans in your area, then obviously that disclaimer is slightly different. But of course, I think most of us don't. By the way, you don't have to do one for every single county you work in. So what you've got to do is look at the county that has the most plans and use that as your outlier, right? I know I had a conversation with a couple of people that had started to go through every single county they represent. Well, if you have a license in California, you're representing over 80 counties. So please do not do this for every county. And of course, if you do out of state, it's the same thing. So just wanted to mention that today as well. Okay, another rule is prohibiting overhyping. Agents cannot use hype or superlatives to describe plans. So best, most, largest, lowest. That's not really changed, to be honest. We all know that as well. And also it prohibits marketing benefits where they're not available. So you cannot market things like, hey, we can give you a food card in an area that they don't have it. So again, make sure you are only marketing items that are available in that area. Requires sponsors' names in marketing. When marketing plan-specific benefits in print ads, include the names of the organization, the Medicare Advantage organization or Part D sponsor in 12-point font. If in doubt, send any marketing to Berwick Compliance Department, Anne McLamery and her team. It's compliance@berwickinsurance.com if in doubt. And of course, prohibiting the marketing of general savings as well. General savings may not be savings for everybody. So things like you can save up to $125 a month on your Part B. Well, that may be only for a subset of people, so you cannot generalize and offer those products. Okay, what is considered marketing? Any material activity that is distributed by any means that mentions any benefit which is considered marketing. Don't forget, the best way to be compliant is use those marketing pieces that have already been checked and validated by Berwick and their team. So use some of those marketing materials that we have on our portal, at Berwick have on their portal, or use the carrier-specific marketing pieces that they have available. They're already checked. It makes it easy for you. Okay, number 8, requires a 48-hour scope of appointment rule. I think I went through this. Please note that a scope of appointment and a BRC is both valid for 12 months. So if you do a scope of appointment today, you can talk to the client in a month's time. Absolutely, you can. And the same thing with a BRC, business reply card, and permission to contact. So if somebody fills out a permission to contact, you can call them in 12 months. So make sure you file them, guys, because they're going to be eligible for you next year as well. The 48-hour rule, I think we went through. We're going to move on from that. Door-to-door contact, we pretty much know you're not allowed to do that. That's been the same for years as well. And again, the effect on current coverage. Agents must explain the effect on enrollment choice on their current coverage when the client is ready to make a plan decision. It's going to be added to the pre-enrollment checklist. And by the way, this brings me into a point. The pre-enrollment checklist now is mandatory. Did you know this? From October 1st, plans, the pre-enrollment checklist is in every single enrollment kit that you have with your carrier, and that is mandatory to complete. So you have to complete the pre-enrollment checklist prior to signing up any single client on their plan. Please be aware of this, folks. Important to note, you have to complete the pre-enrollment checklist. That's one of the things that we really haven't spoken a lot about, but I wanted to make sure you were aware of that as well. Can you pick up kits at the Medicare Center? The reality is, I'm not sure what you mean by that. You can download some material on the Medicare Center, but you can't obviously pick up kits because it's a virtual place. It's where you have your quoting and enrollment tools, but you can download it. Yes, absolutely. Restricts appointment planning on educational event. You cannot collect scope of appointments or schedule appointments during educational events. Don't forget, you can collect business reply cards and PTCs as well as offering business cards. And if you are doing a sales event, you can obviously tell people there's an informal event happening later on, but what you can't do is schedule an appointment at an educational event. Marketing events after educational events, it now requires them to be 12 hours apart, but you can do them after 12 hours. And again, that has to be in the, that could be either the same or adjacent building as well, but it's got to be that 12-hour notice. Okay, that's all the items that I wanted to run through this morning for now. I'm going to pass you on to Judy, but while Judy gets settled here, let's go through your questions. Hopefully that information was good there as well. And again, please You know, if you've got questions, put your questions in the Q&A. I've seen a lot of good comments in the chat. And again, a lot of you newer agents, I love the fact you're going in the chat saying, hey, I'm feeling under pressure. There's a lot going on. You know, what can I help? You know, can I get some help here as well? So we can absolutely help. So reach out to us. There's a lot going on as well in a lot of different areas as well. But please put your questions in the Q&A so we can get those answered. So Judy, I'm going to pass on the baton to you. Thanks for coming on. You're going to run through these 2024 Medicare updates, right?
Yes, I am. And as Neil mentioned, we did get the communication from CMS yesterday. This time of year, we always look for it, but we put it in a very concise way for you. And this will be available as a PDF of cheat sheets that's going to be posted on AMA's portal, as well as available to email out to you. So the Medicare Part B premium for 2024 is going up $9.80. Not too bad. It's going to $174.70 for 2024. And the Part B annual deductible is going from $226 to $240 for 2024. That's an increase of $14. Again, not too bad, but still an increase. And the standard immunosuppressive drug premium is $103. For those who don't know this, beginning this year in 2023, people who had full Medicare coverage because they were under 65 and they had let's say end-stage renal disease and they had a kidney transplant. In general, kidney transplant recipients, if it's successful, lose that Medicare after 3 years of it being a successful kidney transplant. However, people who don't have other types of insurance, when they lose that Medicare coverage, can still get Part B coverage of those immunosuppressive drugs that they need to keep healthy with that transplant by paying a premium. So they are able to get this because they may not have other drug coverage and other Medicare coverage, because this is covered under Medicare Part B for these immunosuppressive drugs. So it's $103. It is slightly higher for IRMA if somebody has a higher income, and we'll go over that in just a moment. Next slide. So here's your standard Part B premium if they have a higher adjusted gross income on their 2022 tax return. So again, $103,000 or less, they're still going to pay that standard premium of $174.70. But as you can see, it goes up on a sliding scale with the maximum of $594. Next slide. So for those Part B immunosuppressive drug coverages, the person, if it's $103,000 or less, is going to pay that standard amount of $103. Again, this is only for their Part B immunosuppressive drugs, which are very expensive. And if they have a higher income, of course, then it can go from $171.70 to $515.10 on that sliding scale. Next slide. Okay, Part A premiums. Again, most people don't pay for a Part A premium because they've worked at least 10 years or 40 quarters paying into those FICA taxes. But if they've paid into FICA less than 10 years, they can buy their Part A. If they've worked 30 quarter hours up to 39 quarter hours, then they can pay a $278 monthly premium in 2024. That's the exact same amount as 2023. If they've worked less than 30 quarter hours paying into FICA taxes, they can pay $505 per month to get that Medicare Part A, which is actually $1 less than it is in 2023. Next slide. So inpatient hospital amounts. So again, the deductible for Medicare Part A, if you're admitted as an inpatient into the hospital, is $1,632. That's up $32 from the $1,600 that it is in 2023. Day 61 through day 90, it would be $408 per day. That's an increase of $8 a day this year. And days 91 to 150, which is the 60 lifetime reserve days, goes from $800 to $816 per day for 2024. Again, all days after 150, person would pay all of those costs. Skilled nursing facility, daily coinsurance. The first 20 days under Medicare is zero copay, but once you are in there for day 21 to 100, it is $204 per day. That's a $4 per day increase from 2023. Next slide. Here is your Part D IRMA premiums. So again, $103,000 or less. And this is again on your 2022 tax return adjusted gross income, then that would be the flat plan premium, whatever Part D plan the person has. However, if they're more than $103,000 in income, you can see that up to $129,000, it would be $12.90 added to that plan premium. Now, let's say that somebody had a Medicare Advantage plan with Part D coverage and their Medicare Advantage plan premium was zero. Well, you still got to pay this IRMA amount of $12.90. That will be paid to the insurance carrier on behalf of Social Security, where it eventually ends up. So these are the amounts, again, on a sliding scale based on income. All right, Neil, I made it short and sweet. And by the way, Neil did have a question from some agents about LA Care leads. I will tell you that they just got some into my hands, and I will be distributing those. If you are interested and you have been selling LA Care in the past, I do have some leads. It's a very limited amount, but we do have some. Just let me know in an email, Judy@berwickinsurance.com. Any
Great.
questions, Neil?
Yeah, I'm going to run through a few questions here. So that's great about the LA Care leads. Really appreciate that, Judy. And as they come in, I'm sure we'll get some of those. Don't forget, Judy covers all of Berwick Insurance Group in California. So she got to distribute those out fairly as well. But if you've sold in the past or you are committing to selling LA Care and focusing on that, I'm sure we can help you out there. But so thank you for that update. Okay, let's go through these questions here. First of all, what email did you say? So basically, if you are not connected to the AMA portal and you haven't been able to log in and you can't find the email you originally got, we resent one last night. It came from WordPress, which is what the company we utilize for our website. So again, if you should have got that last night, it was a reset of your password or a reintroduction here. So if you cannot find an email or you do not have access to the AMA portal, that is why you should be looking for that email that came out last night. Okay, question here for you, Judy. Will Medicaid continue to pay the Part B premium if a kidney transplant is currently full dual?
Yes, they will.
There we go. Wonderful. Thank you. When you finish your presentation, can you go back to the IRMA income thresholds? I will do that.
Actually, he said disregard. He was looking at the file and married separate.
All right. Okay. Sorry.
Yeah. It's
Thank
okay.
you very much. Okay. Okay. That was an individual one for me. Okay. Is LA Care lead different to a call blitz? Yes, it is. A call blitz is when a carrier or an entity gets a ton of leads, they get a ton of agents on a call or in a room, and they hand out leads then and there. Okay? So it is totally different. Okay, let's carry on here. Where do we find the cheat sheet, Judy?
Again, cheat sheet is going to be a PDF version of what you just saw on the screen with the presentation. So that will be emailed over to Neil and Lisa, and they will put that on the portal, AMA's portal. They will also have it available to email out to you as a PDF if you want to email Lisa and ask for one.
Perfect. And yeah, that's a great point, Judy. What we're trying to do is help you guys be self-sufficient. So the portal is there so we can put these documents on so you don't have to ask us that question every time you want a PTC or every time you want a scope of appointment. That's why we have the portal to help you be self-sufficient. If you're not on there and you need it desperately, yes, we can email out, as Judy said there. But again, we're going to try and provide you all of this on the portal. Okay, a green card holder for 7 years, and they have under 30 FICA quarters to their taxes, would they qualify for Part A and B?
So the answer to that is yes, because the qualification is that they have to be age 65 and older or under age 65 and qualify because of a disability, being on Social Security disability for at least 24 consecutive months. And again, they have to be a legal resident of the US for at least 5 consecutive years. So they don't have to be a US citizen, so they can be a green card holder for at least 5 years. And if they do have that ability, then they would qualify for Medicare. Now, they can, of course, purchase their Medicare Part B. That is not an issue at all for anybody. That's what everybody does. But to get that Part A, again, they're going to have to pay for it if they have less than 30 quarter hours or less than 40 quarter hours, I should say. So yes, they can buy it, and they would definitely need to do that. So go out there and let them know that they can do that.
Awesome. Thank you so much. Next question, and I'm pretty sure I know the answer to this. Is there a generic pre-enrollment checklist? I believe there is not, because it's added to every kit. The one question I have on this, Judy, do you know if that's going to be included in the 2024 Medicare app and the Medicare Center?
Yes, it is. It's one of those things that you're going over with them on that application.
Okay, wonderful. Okay, on the OMA Part D, did you say that if the member enrolled into MAPD, the member still has to pay the difference from the standard Part D premium?
That is correct. There is still these extra premiums that the person has to pay on a sliding scale. Even if you're on an MAPD plan, that is what you have to do.
Yeah. And then just on Donna Marie's question about that couple who have the under 30 quarters, can they apply for LIS and therefore the Medicare Savings Program? Absolutely, they can.
Yep.
Absolutely. So one question here, Judy, I've got, it was actually texted to me last night. An agent here got a letter from a client. This is good for folks to know. And it says, they'd like to talk to you about your spouse's enrollment into Medicare Part B. They received an application, but the spouse then died. And it's offering coverage to the wife of the spouse that died on his Medicare. So can you just tell us a little bit about that and how that works?
So is this for the spouse to qualify for Medicare?
Yeah, and she's under 65. It says, we would like to talk to you about a spouse's enrollment into Medicare Part B. An application for Part B was submitted in January 2023. We're sorry to hear about the death of your spouse in April. The Medicare coverage would be January to, all right, it's for the January to April. I see what you're saying, yeah.
Yeah, I mean, this in general, just for you guys to know, Medicare is different from Social Security benefits. Social Security does have survivor benefits where you can get the greater of your dead spouse's income from Social Security or yours, whichever one is greater. But for somebody who's under 65 and your spouse has Medicare, can you get survivor Medicare? The answer is no. You can't get survivor Medicare unless that spouse who's under 65 is disabled or in need of kidney dialysis and didn't qualify for Medicare on their own.
Yeah. And I've just read the whole letter now. And what it's saying, Judy, in fact, is they got the spouse that died got Medicare in January and then passed away in April. So they want their premium from January to April. And what they're saying is if that client went to the doctor in those 3 months and they don't pay that premium, then they're going to get a bill for the full doctor amount. So they're basically saying, sorry, your spouse died. We want money. That's pretty much
exactly.
What so
exactly. Yeah, there's no such thing as spousal Medicare survivor benefits.
yeah.
Okay, you got to qualify for Medicare on your own, or if you don't qualify for the free Medicare Part A, or don't qualify for Medicare on your own, once you turn 65, you can get it based on your spouse's work history.
The likelihood is if that client died in April, they probably had care between January and April, so they probably better off paying that $600 premium. That's what I would advise.
Yep, Absolutely.
Excellent. And quick question, last question on here, and we'll move on, Judy. What's the best way for a client to apply for Medicare Savings Program or extra help?
Well, the Medicare Savings Program is part of the Extra Help application in a way. There is one question on the Extra Help application. So go to ssa.gov, the website for Social Security, and go to apply for extra help with Part D. Once you go in there, you're going to apply for the LIS. And by the way, you can help your client do this over the phone. There's no signature required on the LIS application. So you're going to do that. It'll take you about 15 minutes, but there is a box to check if you do not want your information sent to the state to see if you qualify for other programs. Now, you don't want to check that box because you want your information to go to the state. And in some cases, they will then see that you qualify for the Medicare Savings Program and they'll do that. But the very best way to apply for the Medicare Savings Program is to do an application for the QMB. And if you don't qualify for qualified Medicare beneficiary status, then they may qualify for some of the 3 other levels that they have. Doing that application, it's by state, so it's a slight variation in each state, and then it gets mailed into a particular office that processes the qualified Medicare beneficiary or Medicare Savings Program applications. In California, there is a list of every single county that I believe you have on the AMA agent portal, if I'm not mistaken, Neil, as well as the application.
Correct.
But if you need that application and you need that list of county contact offices in California, please email me, judy@berwickinsurance.com, and I'll send it over to you. It is available in various languages as well.
Wonderful. Thank you so much. Okay. Yeah, I'm just answering a question here. So yes, basically the question asked, Judy, and I've been answering it through text here. Can a spouse qualify for, Part A to be paid for through their husband's work history? Yes, they can. Even if the husband is under 65, as long as they have qualified for those 40 quarters, it doesn't matter what age that husband is. If the wife is 65 and he's already paid for those 40 quarters, that's already in. They have that coverage. So absolutely. Hopefully that made sense there. Okay, well, we're going to move on here. And any questions, keep going. We'll run back if we have time. I said I'll try and keep it to 30, but, lots of great questions and scenarios here. So we want to run through. So Aetna, this is our carrier updates in Nevada. Aetna here, folks. Lots of lots of kits and enrollment kit pickup. As you can see, take a photo. If you haven't got this email, it was sent out to most people. But again, you can see that over the next couple of weeks, lots of opportunity. And all of those folks that we love there at Aetna are out and about to try and help you. And of course, guess what? We are very important to all of our carriers at the moment because you are the ambassadors. You are the folks that are going to sell their product. So this is going to be definitely the time of the year they're going to show you lots of love. So there we go. CenterWell, important. Anyone on this call from Nevada who sells in Nevada, as you know, you have to do a recertification to be compliant for 2024. And this is all about doing the certification to receive that $125. If you refer and book an appointment, it's an appointment fee. So to do that, it's so simple. You've got to do that certification, schedule your client's first appointment using the telephone or the online tool. Then you get $125, $150. So please make sure you're certified, because if you start referring these clients to CenterWell and you're not certified, you're not going to get that money, folks. You're not going to get that money, and we do not want to leave money on the table. This is a great opportunity. We are doing a ton of CenterWell events this year, in fact, and this is a fantastic opportunity for you folks to add another $125 to your your average transaction value when you sign somebody up. So please do that as well. And again, you can see those are the networks. These are the plans that CenterWell obviously accept here: Aetna, Alignment, Humana, WellCare, United Healthcare, and Cigna, the brand new plan into Nevada this year. So please, if you've not done this, please do. I am going to be setting up a Zoom call this week with CenterWell. Yep, trying to do that as well to make sure you can do that recertification as well. But please do that. If you're on this call from Nevada and you're not done that certification, you're not sure, let me know. Humana carrier updates. They are looking through all of these plan codes. This is a one-pager that you should have been sent out showing all the different codes. As you can see, Humana has a ton of plans in Nevada, folks. Please make sure you're using the right codes for the right plan. Again, they're very competitive this year. And this is page 2. We had to put it on page 2. They have that many plans. P3 as well. Similar, they have the preferred broker program. You and your clients receive services that aren't available anywhere else. If you're interested in learning more, please take a photo of this, call that number, or email kbells@p3hp.org. P3, and again, those are the plans that P3 accept: WellCare, Humana, Alignment, Aetna, Anthem, and Scan. That is not on there. Going to have to reach out and tell them that. Scan is brand new to P3 for this year as well. Opportunities to partner on community engagement events. Wow. Hey, everybody's asking about getting introductions to medical groups. Do this. These are the sort of things that are going to help you grow your business, folks. Support with relationships, direct access to clinics, team trainings, informative broker newsletter. And again, they have a program where you can also get an incentive from P3 to sign folks up as well. And again, there's a lot of resources available there and tools to help. And of course, they mentioned Scan on this page, which is great news there as well. But they've got a lot of products as well. And there's the broker appointment program now offers online scheduling. Yes, it does. You've got to contact them to get part of the broker appointment program. You get $125 for every new patient. Can you believe that? They're paying you to do your job even more. So this is a great opportunity with both CenterWell and P3 in Nevada as well. There's also an open house for the new Nellis Clinic. Take a photo. This is a great opportunity to go to. I'll be going to this event in November, maybe. So please put this down, particularly if you live in that area. United Healthcare have got their grids as well. This is for agent use only. Yes, this is the grid. It's like a shopping sheet. You can order these as well. This should have been sent through to all of you. This is a great opportunity for you to compare side by side all of United Healthcare plans. This is what they do really well. This is also available in California and other states as well. So as you can see, you've got all the C-SNPs, D-SNPs, and the other SNPs that may be available there as well. And as you can see, there's quite a few pages on this. And a reference sheet and a reference guide. They also have their product portal, which is live to go. WellCare in Nevada are doing Let's Talk Leads. Turn it up Tuesdays and Thursdays with Nevada and their regional agency manager, Mr. Greg Stickler. Weekly lead discussions on getting and working leads. Guess what? I pretty much think if you start going on these calls, you may get leads from WellCare. What may you want to do throughout AEP? This was sent through this week. It's already started. So please, if you are interested in getting leads during AEP, commit to going on to some of these things, folks. Look at all the opportunity you have this year. I have not seen this amount of opportunity in probably the last 8 years, 10 years. And, there's a ton of stuff going on that's going to help you grow your business. You've got to be in it. You've got to work hard. You've got to be present. That's the key thing here. You've got to be present and really focus on this activity to be part of these programs. Let's look at California. We've got the underwriting holiday and the bonus approved by Blue Shield for their MedSup. They are really focusing on MedSup, particularly in some of these areas that folks are pulling out of some of these plans. Again, Central Health Brand New Day, they just added your book of business onto the broker portal so you can make sure you focus on retention on that book of business as well. More grocery retailers are being added, including H Mart and TS Emporium. These are two opportunities where they can use that grocery card in person. Molina enrollment guides are ready in California. You can also order them emailing salesengagement@molinahealthcare.com. What else have we got? We got some training coming up on October 23rd on their products. So there's still training happening in AEP, particularly if you're a new agent and you want to get involved. These are great opportunities as well. Also, hot off the press, Molina has kiosk space at Ralph's locations. They're going to cover all the costs associated with Ralph's. This is in California. This is just a little list here as well. And again, it shows you how many visits they're getting per month and the opportunities here. This is Ralph's and Molina. If you want to sell Molina, particularly good with their D-SNPs, I believe. So this is a great opportunity to do some co-locating in Ralph's for Molina. There's a process to go through. If you haven't received this email, I'm going to make sure Lisa has the information. You can reach out to her. I know she did a great job with Scan. She's not available today, actually, so you'll have to email her next week, but she will be available next week to answer some of these questions. We'll make sure she has this list as well if you're interested. And I think they can turn this around in like a really quick time. I think they mentioned like 3 or 5 days or something crazy that they can turn this around for you. Scan product update. So the new PSP plans, and that is the physician specific product plan. Instead of Optum, Scan Compass is going to be anchored around a different medical group as well. So that is going to be changing. They are finalizing details, and so look out for the new provider. I think I know who it might be, but I'm not sure if I'm allowed to tell you. Maybe Judy can. But they are finalizing the details here. So Optum and the Scan Compass is not happening. If you are doing specific events for Scan and Optum, some of you folks are doing those educational and seminars. You can also focus on the $199 MOOP and the fantastic plan with Classic, and obviously all of their formulary stuff they're bringing through. So you'll be able to do that indeed. Torrance Memorial have got an in-person event and a lecture coming out here at the Hoffman Conference Center. So be sure if you want to focus here with Torrance Memorial. And don't forget they're an affiliate of Cedars-Sinai as well. Finally here for California, if you are selling in LA County and want some leads from United, what? We can get leads? Yes. They are doing their first call blitz of the season. I spoke to Rosa myself. She said, as long as you sell in LA County, you don't have to live there. So this is going to be an opportunity to get some leads. These may be PDP leads. What's happening with United Healthcare PDPs in LA County and in pretty much every county? They have increased by over 100%. So this might be an opportunity to, guess what? Talk about the PPO plan. Hey, all your costs are going up on your Med Sup and your PDP. I'd love to talk to you about the brand new PPO plan. These are great opportunities, folks. Take advantage. If you're interested, please, you have to email or participate by replying directly to Rosa, rosa.calindris at United Healthcare or uhc.com. Take a photo of this screen if you are selling in LA County. That's all she's interested in. And by the way, we are going to do some AMA specific call blitzes. They are going to be doing a number of call blitzes every single week, and they're going to do that in Pacific Central Coast as well. Don't lose out, guys. Get involved. Be part of these events. It's going to help you grow your business here as well. And then the rest of the states, obviously, Aetna and their Medicare Solutions, which is all about their Med Sup. They've got their AEP marketing materials and portal all available, and they've got some trainings coming up virtually there. You can see on the right-hand side as well. They've also got their enrollment tracker webpage, so you can track your enrollments and all of those Med Sups that you are putting through Aetna. Alignment, HRAs are back. So the HRAs you conduct for D-SNPs, you get 150. For C-SNPs, a solid 100. The incentive program is applicable to enrollments with effective dates 11 and 12/1 and all of next year. So if you're selling C-SNPs and D-SNPs through Alignment, you can get another ton of money as well. These are the plans that are available here. So please be sure to look. These are the 2023 plans. I'll take a sip of my coffee while you take a photo. These are the 2024 plans that are available through it. Give you a chance to take a photo. You should have been sent this if you're in any of these states. You should have received this from Alignment already. We're just going over this as well. Okay, October 1st is the date to visit the Medicare Center and check out all the great 2022 features. Trouble logging in, clear your cache and cookies, not seeing all of the plans. Most plans load on 10/1, but some regional carriers may take till Sunday to load up. So yes, I know you've been reaching out, you've been emailing, you've been doing all of this stuff. By Sunday, you'll have everything good to go. New features available on the Medicare Center: enhanced RX drug quoting, personal agent website, policy snapshot, MBI Part A and B effective date validation, the Ask Integrity AI. I've not used that yet, so if anybody has, let me know. And the RTS attestation, adding additional states to your current contracted carriers contained within your settings. You must request state appointments with the carrier prior, to a testing. Cigna, many great reasons for selling Cigna healthcare plans. And don't forget their PDP plans are commissionable next year. Don't forget, Cigna Healthcare is offering standalone PDPs, dental, vision, hearing, fitness, post-hospital meals on all their Medicare Advantage plans, 0 premiums in all markets. Part B give back. They got a great Part B give back in Nevada of $115. Great company. They have a great name. So we talk about selling the brand. Cigna is part of that. And again, folks, in Nevada, we have some co-op with Cigna. So if you've got some ideas on what you want to do out there, we're happy to help you. And they're offering commissions on their PDPs as well. Devoted Health, we've started to sell Devoted. They're a great company, have some great tools. They've got digital enrollment kits. They have a great agent portal. They have some great stuff going. They're not out this side yet, but I believe they're going to be moving into Nevada next year and possibly out to California as well. So you're going to hear more about Devoted Health. I know we got some folks in Texas already and Florida. You should be contracted with Devoted. They're a great company to partner with as well. And finally, Scan is going to give you the $125 back for your AHIP certification if you sell 5 products through Scan. That should be pretty simple. There's some great areas of plans that Scan are offering some great opportunities for us as well. Select Health formulary changes, lots of changes to prescriptions. They are coming top of the list when it comes to formularies as well. Don't forget about the agent expense reimbursement program as well. And that's through December the 1st. So once you've done 5 policies, you get another $500. Pretty nice, right? So again, they've got the 5-star plan. You can sell that 5-star plan until November 30th as well. They've got a library of information and materials there as well for all of you in the different states. And that new Kroger plan, the new Smith's grocery benefit, they've got a YouTube where you can watch how members can use that benefits. Maybe you can show the members how they can use those benefits as well. And of course, United Healthcare has that Medicare product portal. It enables you to see multiple states, multiple counties, what the plans are doing, all of the contacts in those counties. So if you want to contact for United Healthcare in another state, you go on that product portal, it will give you all of that information. Woo, we got through 62 slides in less than 55 minutes. That was pretty impressive there as well. Judy, anything else from you that you want to add before we try and give these folks 5 minutes back on their day?
Just one last thing, make sure that you are looking at the formularies for these plans, especially if they are C-SNPs. You'll find, for example, from yesterday, an exercise that I did with an agent that was doing a sales meeting, there was a 0 copay for tier 1 in a C-SNP plan. And we looked up Januvia, and Januvia was listed as a tier 1 on United Healthcare C-SNP in Ventura County. You got to look at these things, you guys, because in that particular instance, tier 1 was covered through the gap at a 0 still. So that is one of the most competitive priced formularies in Ventura County. So just making sure that you understand, you got to look and do these needs analyses to make sure that you're quoting the correct plan for that person's needs.
Absolutely. Absolutely. It's so important. That's the first port of call. We always say use that needs assessment form, the needs analysis form. Doctors, drugs, 2Ds. You've got to remember that. That's the first two things you should look at for any enrollment. Another question about the pre-enrollment checklist. Already answered it, guys. There's a specific pre-enrollment checklist in every single kit. Every single kit. If you're doing an online, it should be on the Medicare Center, as Judy mentioned as well, as part of the enrollment process. But that's by every carrier and every kit pre-enrollment checklists. Whew, I think we're there. I think there's a lot of information today. We have recorded all of this. It will be on the portal very soon. I appreciate all 70 of you that came on the call today. You early birds are getting that information and you are catching that worm. Don't forget, folks, if you want to have the most successful AEP, you have to be present. You have to show that engagement towards these events that are happening. Take advantage of the stuff the carriers, the AMA, your upline is providing, because if you don't, you may be disappointed in 7 weeks' time. So please be sure to make sure you are focusing on doing a lot of those activities, getting involved. Thank you so much for your time. Have a wonderful weekend. Happy AEP. Don't forget, text me with great news. If you are enrolling 2, 3, 4 people on Sunday, send me a text. Tell me the great news. Love it. Please communicate. Utilize our sales reporting tool. Thank you so much. Have a great weekend. Take care.